Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Melody Sims and Tara Gentry, both of Family Practice Associates, and both do with scheduling and front office and medical information and all kinds of stuff. Welcome.
Thank you.
All right, Melody, let's talk a little bit about scheduling appointments. How long does it take?
It doesn't take a long time to get in. We have some same-day appointments every day that we save back for acutely ill patients. You can call that day and get in if you call early. To schedule the actual appointment, if you're an established patient, a couple of minutes and you'll be done.
Okay. Now, that's for like same-day appointments, but sometimes physical exams get put further out because you're trying to save appointments for sick patients.
Right. The best thing to do is schedule your follow-up appointment as you leave your follow-up appointment, or schedule your next physical as you leave your physical. That way you can have a much better chance of getting in with your preferred provider.
So Tara, there are different kinds of appointments that you save.
Yes, so we do have several different kinds of appointment types and different lengths of time tied to those appointment types, just kind of depending on what you're being seen for, as well as there's different questions and consents that are tied to those appointments. So that's why it's important to do the registration.
Okay, and we're going to come back to registration in a minute.
Yes.
But what information is helpful when they call for an appointment, Melody?
If you're calling for an acute appointment, we just need to know your symptoms, the duration of your symptoms, if you have a preferred location that you want to go to. If you're calling for anything else, we need to know if you want your Medicare wellness, if you're calling for your physical, if you're calling for a 3-month follow-up for hypertension, whatever it is that you need, and then we'll get you in the right spot.
Okay, and there may be some give and take back and forth trying to figure out what you actually do need.
Yes.
All right. Is there a better time to call?
Well, our phones are officially open Monday through Friday, 8 to 5, and that is when you can call and get a refill, you can get an appointment, you can ask about medical records. But we have a new assistant now. Her name is Sophie. She is our new AI agent, and she works 24/7, 365 days a year.
Well, and we've got a picture of Sophie up there. That's the avatar, I guess.
That's Sophie.
And so tell me a little bit about her. How's it working and what's it like?
Sophie is easy, okay? She is, she never takes vacation. She never calls in sick. She's there on the job. So if you wake up at 9 o'clock at night and you know you don't feel good, or 4 o'clock in the morning, or whatever your schedule is, and you know you're going to need to see the doctor, just go ahead and call Sophie. She'll get you scheduled for the very next day, and you don't have to wait to talk to anybody. You don't have to wait on hold. She can talk to about 10,000 people at the same time. So when you call her, that's all you have to do is say you want to schedule an appointment.
Now, there are times, though, when you don't want to talk to Sophie because she's AI. You need to talk to a person. That's still possible.
Oh, yes. If you want to speak to someone, you just ask to speak to the operator, and she'll get you to an operator that can take a refill request. If you need to speak to billing, you just tell her you want to speak to billing. If you're calling about a drug prior authorization, she'll get you to that department. If you want the fax number, she'll give that to you. If you want to know the location you're going to, the address of it, she'll give you the address. She's a wealth of knowledge.
Sounds like a perfect employee.
She is, and she doesn't back talk. Yeah, she's very good. We're enjoying her.
Okay, Tara, so let's say you get scheduled, you show up in the office. What information do you need when you check in?
So it's always important to bring your insurance card and photo ID. We always ask for your insurance card every year, so it's important to bring that around, and of course you never know when you're going to have an emergency that you might have to have it. So really you just have to show up at the front desk with that information and we'll get you going.
Okay. You also have the ability to check in online?
Yes. So we do offer you to be able to check in online for your appointment. It reduces the time that's spent with the receptionist once you get there and just ensures that you're ready for your provider. It's just easier, and if you can't do it from home, that's okay. We have options for you to be able to do it in the office, and we can help you if you have any difficulties.
Okay, now you were talking about the insurance card.
Yes.
You do that, you said once a year. Is that really once a year, or is it once every visit? And why do you seem to have to fill out the same form in every visit, or is that the case?
So it is. So To start with the insurance card, we do ask for the insurance card once a year and then any time that the plan changes. And we do that because we want to make sure we have the most up-to-date information on file. We want to make sure you're getting the benefits that you're paying for every month with your insurance. And then on top of, if your provider has to send in a referral or a lab that has to go out, maybe a procedure that has to have a prior auth, they need information off of the card. So we want to make sure we have that on file for the patient. Now, for the forms, yes, we do ask patients to fill them out every time they come in. We have most of our consents and questionnaires through Freesia, so we want to make sure that that's up to date because a lot of those consents are done once a year. So we see patients every 3 months, 6 months, sometimes once a year, and a lot can change in that time. You could have contact information change, like move, have a surgery, and this allows them to update that information themselves.
Well, that's great information. We thank you for all the work you do and the patients you take care of, and thanks for coming in and telling us about it.
Thank you so much.
Thanks for letting us come in.
We'll be right back.